My name's Ashleigh. I am an endorsed midwife and a lactation consultant. I am also a mother to 6 beautiful earthside babies and 6 beautiful babies that didn't get the chance to make it earthside. Today I'm going to be speaking about my experience with surgical management for a miscarriage that I experienced. This particular miscarriage was actually a triplet ectopic miscarriage. I had a baby that was 4 months old and I began bleeding again and I wasn't sure what was happening. I was experiencing some pain in my abdomen and also in my shoulders. I was uneducated at the time and I put a tampon in and I presented to my emergency department because I wasn't sure what was happening. They took me in. They didn't really treat me with much compassion or empathy. They asked me if there was any chance that I could be pregnant. I didn't think that there was, but they still asked for a pregnancy test. I went to sit in the waiting room, which was cold and noisy, and I was scared and I was alone. I was all by myself. They called me back in and they did tell me that I was actually pregnant, so go and remove that tampon and to just wait till I was called in. When I was called in, I was taken for an ultrasound, which showed 2 babies in my uterus. The person who was looking after me didn't really tell me how far pregnant I was, just that they weren't really sure what was happening, but it looked like from ultrasound that the babies didn't have a heartbeat. They did this ultrasound vaginally as well, which I hadn't had before, and it was very scary and very confronting. The sonographer just had this blank look upon her face and she couldn't tell me anything. So I was just laying there wanting to know when my baby's okay, what to expect. And I was just told she couldn't tell me and that I'd have to wait to see the doctor. I did eventually see the doctor who said that I needed to have a D&C, so a dilatation and curette, to remove what was left in my body. I wasn't really explained this with compassion or empathy, and I didn't really understand what was going on. I was very young as well. I was prepped for surgery and off I went to surgery. Once I came out of surgery, I was taken to a 4-bedded general ward and I was in a room full of men as well. I felt really out of place. I felt that I couldn't cry, I couldn't be upset. I was also an employee of the hospital and was being asked by wardsmen and porters why I was there, so it was just not a very nice experience. I did have one positive experience with a social worker who came to visit me, and she actually gave me a Bears of Hope teddy bear, which I still have to this day, and that was probably the best thing that ever happened in any of my pregnancy losses. That was just something that I could have a little keepsake to take home, which was very nice. I wasn't really told how much bleeding would be normal. I wasn't told when I could also try again for another baby if that's what we wanted to do. And I also wasn't explained that I was highly fertile after this pregnancy loss, and if we were having intercourse unprotected, that I could potentially fall pregnant quite quickly. The pain was quite significant and I ended up requiring more pain relief than just your standard Panadol and Nurofen. I needed to actually take some Endone due to the cramps as well, and maybe that was because it wasn't a singleton pregnancy. I did go home, and actually a week later I collapsed on our bathroom floor and was rushed again to hospital where I needed to have another D&C because it turned out I had an ectopic pregnancy which had ruptured in my tube, and I actually lost that tube as well. So that was also something that was really hard to go through. So not only did I have one D&C for this pregnancy loss, I actually had 2 D&Cs for this pregnancy loss because my pregnancy in my tube was actually missed, which was really confronting and really scary as well to experience. I felt like my partner, well, my husband, didn't really have any support either. It wasn't explained to him what was happening, and so yes, I was going through pregnancy loss, but he was also going through pregnancy loss, so he wasn't sure what to expect as well. I just had to wait it all out at home. Lots of bleeding. I wasn't sure what was normal, and just having blood tests every 2 days, but I wasn't really explained why I was having these blood tests, when now I know that I was having my beta HCG levels checked to see that the bloods were actually declining, which no one also explained could take a really long period of time. They didn't drop as rapidly as what they had expected them to drop as well. I also needed to have a fair bit of time off work to get through all of this pain and discomfort from losing my tube and the pregnancy as well. And I just didn't know where to go for questions or for support either. It was quite scary for me and for my family as well. It wasn't a great experience. I guess in the long run, I just wish there was more information out there about what a D&C is and what it involves, and how going to surgery can look, and how this time is really quite a private time, and being admitted to a 4-bedroom with men is not okay. And we should really be supported, and definitely having social work input and more support for where we as women can go, but also where our partners, support people or husbands can also go to find out information of what to expect in supporting someone that's coming through a pregnancy loss.